Hey, it's Peter with Physical Therapy TV. We're going to discuss right shoulder pain today. You might have pain in either of your shoulders. Typically, you get pain in the dominant side. So if you're right-handed, you would get pain in the right shoulder. This doesn't always a hard and fast rule, but many times it's interesting how that occurs. So you might be wondering, why do you get shoulder pain? There's actually quite a few reasons for shoulder pain. Your right shoulder pain could be because of an overuse injury, could be due to trauma, rotator cuff muscle weakness, or poor shoulder position. It's very important to identify the reason for your pain. So if you can, with the assistance of a professional like a doctor or a physical therapist, determine what caused your pain. That's going to be very helpful in terms of prescribing the correct approach to treating your pain, and and give you some relief. So wanted to point out to you poor shoulder position. This is sort of being a little bit on the lighthearted side, but because of our daily activities nowadays, we're in such a forward slumped posture most of the day, where it causes our shoulders to be in such a poor position for function. What I mean by this is that it's almost like the arm bone is shoved into the shoulder socket. Your humerus going into the glenohumeral joint, and it causes a whole host of problems, including impingement, rotator cuff tendonitis, maybe even some adhesive capsulitis or frozen shoulder. Not only does it cause shoulder pain, causes back tightness, neck pain, causes our hip muscles and low back muscles to get very weak and tight, and this can even cause shoulder pain. So it's important to address daily posture and daily postural positions as one of the things you can do to alleviate your pain. So your symptoms might include pain, might include weakness, might include popping in the shoulder, might include ability to sleep due to the pain. It's very important to read your symptoms. If you have pain but you can move your shoulder in all directions, that's usually indication of a tendonitis. If you have weakness in your shoulder with pain and you can't lift it up, might indicate a rotator cuff tear, even an impingement in your shoulder joint. If you have popping, this could be due to a rotator cuff weakness, could be a rotator cuff tear, maybe even a labral tear. Inability to sleep because of pain could indicate a rotator cuff tear, tendonitis, or a frozen shoulder. Adhesive capsulitis or frozen shoulder is a very painful condition, and typically you're not able to raise the arm up to the side or overhead or up behind your back. Usually a loss of about 50% of your range of motion. So treatment wise, steps to take is first seek counsel with a professional. Second step is to end the irritation of the of the movement or reason why you develop the pain, whether it be position, movement, and you do this by just stopping any irritating activities, whether it be forward, lifting your shoulder up overhead or to the side. Ice and rest usually does wonders. Cortisone injection and anti-inflammation medicine helps greatly, and then obviously a very appropriate and correctly designed shoulder stretch and strengthening program. Here's just a couple of my favorite exercises. Shoulder blade squeezes, great to work on the scapular muscles, shoulder blade muscles, and bilateral external rotation with a elastic band, great for strengthening your external rotators. Doorway stretch, great way to target the tight chest muscles, which cause us to be in a very slumped forward rounded posture, which I alluded to prior. So this is a great stretch to work on to fight that. We've got some free information for you over at theshoulderreport.com, and if you need some more help on beating your shoulder pain, you can check that out. Thank you so much for watching this video.